Hi, it's Dr. Kenny Levine with Health Talk. We're seen on WYW19.com and Uverse. I'm here with Iris Cohen, pharmacist at Broward Health. Tell us a little bit, patients get confused. In my office as a periodontist, not only do we give the patient a prescription to take to the pharmacist, but we have printed out instructions as to how to take it. We're very specific. So if they can read, there shouldn't be much confusion. But people get confused about their medications, don't they?
Yes, very often. And a lot of times if they don't take it correctly, they wind up back in the doctor's office or in the hospital. So when we type prescriptions, we try to be as specific as possible. Like if you're taking, let's say, thyroid medication, and if we just tell you to take one tablet a day, that doesn't tell you to take it in the morning or noon at night. So we would say take this before breakfast on an empty stomach.
Okay.
So we're very specific because we want the patients to take the medications correctly.
A lot of the medications that we prescribe do have a specific instruction relative to either before meals or after meals. You want to talk about that a little?
Yes, most medications have side effects. If you're taking something orally, the biggest side effect we see is the stomach side effects, nausea, vomiting, diarrhea, or constipation. So some medications you want to take either on a full stomach or with meals to ease those side effects.
Sure.
But a lot of times the medications have to be taken with meals to aid in the absorption of the medication. And then the opposite is true. Some medications have to be on an empty stomach because food will stop the absorption. And then you have to know what medication you want to avoid with certain foods.
Patients who take multiple medications, I know some very personally, they have to almost draw a map of their day because some medications have to be taken before meals, some have to be taken after meals, some have to be taken on an empty stomach, and they have to plan their medications or plan their meals around their medications. And elderly people have a difficult time with that, don't they?
Yes, they do. And they take the most amount of medications.
I'm sure they do. People go away on trips. They have to take their pills with them.
Right.
I think they carry their pills through security with them. Tell us a little bit about tips that you have for people that have to travel with their medicines.
Okay, so I would strongly recommend if you're going on a 7-day cruise, bring double the amount of medication. We often see people come into the hospital. They only took 7 pills for their 7-day cruise. Now they missed their flight or their flight got canceled. They're stuck here and they have no medication. What are they going to do? They live in Wisconsin or Canada. Or lately we see on the news about the cruise ships that take longer, or
Sure.
With all the snow, the flights are canceled and delayed. So always bring your medication. Always plan for the unexpected.
I was actually on a trip with friends of ours, and one of my friends forgot his medicine. He was in Portugal. We had to get in touch with a friend of a friend of a friend who knew a doctor,
Right.
and we prescribed what he needed, and he was able to get it. But it was a big hassle.
Yes, you should bring it in the original bottle that you get from the pharmacy. If you're just putting 7 different pills into one bottle, that could be a problem for you with security.
What about people who are on IV medicines? Do you have people who come to you and say, I'm going on a cruise, I'm on IV medication, I have to take once or twice a day. How do they take care of that?
Well, they have to bring all their supplies with them.
Including needles?
The needles, the tubing, a sharps container to dispose of the used needles.
Sure.
And then you have to make arrangements usually to keep your medication refrigerated.
That's
so
true.
like home health care, they could deliver a 7-day supply of medication,
Right.
but you have to make sure you have a refrigerator, that it's working, and you have space to have, let's say, 7 or 14 little bags.
And all the alcohol wipes and everything else you need.
Exactly.
Do you, in the hospital environment, do you ever have patients that say, do I have to take all these medicines? They say,
Yeah.
is the doctor telling me the truth? Medicine's expensive. Do I need all of them? Can I take it every other day instead of every day?
Right. And patients, they have the right to refuse.
Right.
If they don't want to take something, or let's say the medication we're giving you is giving you a side effect, the patient has the right to say, no, I don't want that now. I can refuse my 2 p.m. dose of this
Okay.
medication.
All right, we're going to get back to this in just a moment. Thank you. It's
Okay.
Dr. Kenny Levine with Health Talk. We'll see you in a minute. Thank you.